Hello, good afternoon. My name is Lashanti Harrell, and my presentation will be on Dengue hemorrhagic fever. Okay, here's the agenda for today. The definition of Dengue hemorrhagic fever is a severe form of dengue fever caused by the dengue virus, transmitted through the bite of an infected Aedes aegypti or Aedes mosquitoes. It is characterized by increased vascular permeability, blood plasma leakage, thrombocytopenia, low platelet count, and a tendency for bleeding, which can lead to life-threatening complications if left untreated. The signs and the symptoms consist of a low platelet count. Low platelet count can lead to an increased risk of bleeding and bruising, detectable through laboratory tests and clinical signs like prolonged bleeding from minor injuries. High fever, sudden onset of a high-grade fever lasting 2 to 7 days, often accompanied by chills and body aches. Random bleeding is a symptom, including nosebleeds, bleeding gums, blood and vomit, or stool. Any tiny red spots on the skin or easy bruising may also occur. Severe abdominal pain, persistent or worsening abdominal pain, often indicating severe plasma leakage or organ involvement. And lastly, it's restlessness is the final sign and symptom. Sudden behavioral changes such as aggravation, drowsiness, or restlessness, which may signal the onset of shock. These symptoms can escalate if left untreated, potentially leading to complications like dengue shock syndrome, DSS. The origin of the disease. Okay, the origin consists of the causative agent. The causative agent is the dengue virus, which belongs to the gene flavivirus in the family of Flaviridae. Okay, there are 4 antigenical district serotypes: DENV1, DENV2, DENV3, and DENV4. Infection with one's serotype provides long life immunity to that stereotype, but increases the risk of severe disease upon secondary infection with different stereotype. Okay. Mutation and adaptation. The virus has evolved mechanisms to survive in both humans and mosquito vectors, adapting over the centuries to exploit human environments. Okay, the causes consist of natural reservoir or vector. Reservoir humans are the primary hosts. Vectors, the virus is transmitted to humans by these mosquitoes. These species thrive in tropical and subtropical climates and are well adapted to urban environments. The historical emerge started around pre-20th century. The dengue fever had been described in medical literature as far back as 1779 through 1780 during major epidemics in Asia, Africa, and Americas. The DHF emergence, the severe form of the disease, DHF, first emerged during the mid-20th centuries. Major outbreaks were documented in Southeast Asia during the 1950s, especially in the Philippines and Thailand. Post-world urbanization. DHF became more prominent after World War II due to rapid urbanization. Poor water management and increased intentional travel, which enhanced the spread of both the virus and its vectors. Ecological factors also is a cause. Expansion of cities in tropical regions created ideal breeding grounds for these mosquitoes, standing water in containers and poorly managed waste. Climate change, warmer temperatures, and changing rainfall patterns expanded the range and reproductive cycle of mosquito vectors. Deforestation, the displacement of mosquito populations in forests into human inhabited areas increased the transmission risk. Secondary infection and immunopathogenesis, sequential infections. The phenomenon of antibody dependent enhancement increases the severity of diseases in individuals affected with different serotypes after a prior infection. This immune response is thought to underlie the transmission from the classic fever to DHF. And lastly, immune response hyperactivation of the immune system leads to plasma leakage, bleeding, and other life-threatening complications. Okay, the primary route of transmission is through the bite of an infected Aedes mosquito. These mosquitoes become affected by feeding on the person who has Dengue, I believe it's Dengue virus, in their blood and later transmit the virus to another person. Examples consist of the mosquitoes thrive in urban settings where standing water is present, such as in uncovered water storage containers, discarded tires, or flower pots. In rural areas, a secondary vector can breed in natural water collections like tree holes or bamboo shrubs, facilitating transmission in rural and forest regions. Okay, in Brazil, unregulated urban growth and improper waste disposal created ideal breeding grounds for these mosquitoes. For the spread, human to mosquito to human cycle. The virus circulates between humans and mosquitoes, perpetuating the disease in areas where infected individuals and mosquito vectors coexist. Specific examples consist of during the outbreak in the Philippines, a single infected individual in a densely populated neighborhood led to a chain of infections as mosquitoes fled on multiple people in close proximity. Household clusters, families living in shared spaces or with poorly managed water storage are particularly vulnerable, as infected mosquitoes can bite multiple people in the same household. The vector transmission in mosquitoes. The mosquitoes can transmit the virus to their offspring through their eggs. This form of transmission allows the virus to persist even when there is no active human cases. Example, in Sri Lanka, researchers discovered that the Dengue virus persisted in mosquito eggs during the dry season. When the rain returned, the hatched mosquitoes continued to a new outbreak. Travel-associated spread. Travelers infected with the Dengue virus can introduce the disease to non-epidemic areas where contact mosquitoes are present, leading to local transmission. Examples: a case in Florida. A traveler returning from the Dengue country infected local mosquitoes, causing a small outbreak in previous low-risk areas. International events, large gatherings like the Olympics or the World Cup have been associated with increased movement of infected individuals, potentially sparking local outbreaks. Rare routes of transmission. While not common, there are other potential but rare models of the Dengue virus transmission. Maternal fetal transmission. Pregnant women infected with Dengue can transmit the virus to the fetus, potentially leading to complications like premature birth or low birth weight. For example, in Thailand, cases have been reported whereas neonates presented with DHF symptoms shortly after birth due to maternal transmission, blood transfusions, and organs transplants. If a donor is carrying the virus in their blood, transmission to the recipient is possible. For example, in Puerto Rico, isolated cases have occurred where the dengue virus was transmitted via contaminated blood donor. Needle stick injuries. Healthcare workers exposed to contaminated needles or medical instruments, could potentially contract the virus. The environmental and climate also plays a role in the spread. The change in climate, urbanization, and human activity indirectly facilitate the spread by creating ideal breeding conditions for mosquitoes. Specific examples: in India, moonshine rains create numerous stagnation water sources, leading to increased mosquito populations and subsequently rise in dengue cases. Another example of deforestation. In Malaysia, deforestation brought human populations closer to mosquito habitats, increasing the frequency of interaction between infected vectors and humans. As far as the treatment of the disease, a preventive measure consists of, while not a direct treatment, vaccinations play a crucial role in preventing dengue infections. The development of vaccinations represents significant strides in the dengue prevention. Dengue vaccination strategies are reviewed in the pediatrics discussed in the implementations of the dengue vaccine in epidemic areas, highlighting its potential to reduce dengue incidence and severity. Okay, this graph shows the number of annual cases from 2010 to 2019, and as we can see, from 2018 to 2019, there's a great spike in the number of annual cases compared to the years prior. For the treatment of the disease, the platelet, blood, and transfusion, these are reserved cases with significant bleeding or severe thrombocytopenia. Fresh, frozen plasma or platelet concentrations can stabilize patients experiencing severe bleeding disorders. Medication such as acetaminophen are used to reduce fever and relieve pain. Other supportive measures like managing nausea or ensuring adequate rest fall under this category. Non-steroid anti-inflammatory drugs are avoided due to bleeding risks. Another treatment of the disease can be intensive care support. Patients with severe complications like dengue shock syndrome or multiple organ failure may require ICU care for ventilatory support. Hemorrhagic stabilization and continuous monitoring. Antibiotics for secondary infections. Although antibiotics are not used for dengue itself, they are crucial in management through secondary bacterial infections if present. Electrolytes and glucose management, maintaining proper electrolyte balance, and treating hypoglycemia through intravenous administration are crucial in critically ill patients. Monitoring warning signs. Closely monitoring for symptoms such as abdominal pain, persistent vomiting, rapid breathing tendencies, and sudden changes in the hemocretin levels is essential to intervene before severe complications arise. Lastly, fluid resuscitations, early and appropriate fluid replacement therapy using is crucial to managing plasma leakage and preventing shock during the crucial phase of this illness. According to the pie graph, based off of all the reasons and the treatments listed, the top 3 consist of monitoring, fluid replacement therapy, and systematic treatment. Okay, monitoring consists of 15% of this pie chart. The fluid replacement therapy consists of 50%, and the systematic treatment is 35%. Okay, some of the questions that we have consist of: why is fluid replacement therapy considered the most crucial aspect of treating Dengue hemorrhagic fever? What are the risks of NSAIDs for symptom management in patients with DHF? And what alternatives are recommended? How can healthcare providers ensure early detection and management of complication in DHF patients? Lastly, what measures can be taken to improve access to intensive care for severe cases of DHF in resource-limiting settings? And for our conclusion, Dengue hemorrhagic fever requires comprehensive treatment approach, emphasizing support care and the management of the complications. Fluid replacement therapy is the cornerstone of the treatment, addressing the critical need to restore blood volume and prevent shock. Symptomatic treatment, including fever and pain management, plays a vital role in improving patient comfort while avoiding complications such as excessive bleeding. Okay, and this is my reference pages. Thank you.